Hello, everybody. Welcome to my channel, Island Daily. My name is Dr. Amen, and I'm an optometrist. And today we're going to talk about ocular appendages. And you might be thinking why I have this sad face. It's because we are going to talk about expressions today. As usual, we are going to make a diagram to understand the anatomy. So, this is the diagram of the eye, and in this video, we will grossly talk about these structures. So, first one here is our eyebrows. Now, the function of the eyebrows is to stop any debris coming from the forehead or sweat which is dropping up from the forehead, and the eyebrows will block this debris and the sweat coming down towards the eyes. The medial end of the eyebrows lies below the orbital margin, and the lateral end of the eyebrow lies above the orbital margin. Now, earlier in this video, I've said that we will also talk about expressions, and the expressions are majorly formed by the eyebrows. So, if we want to raise our eyebrows, our frontalis muscles, which is our forehead muscle, the frontalis muscle will contract and the eyebrows will be raised. Now, if we want to lower our eyebrows, the orbital part of the orbicularis oculi muscle will contract to lower the eyebrows. This happens when we squeeze our eyes, and may have noticed that the eyebrows are also lowered. Now, if the eyebrows are moved towards the medial side, here we have two muscles, corrugator supercilii and procerus muscle. These two muscles will contract to draw the eyebrows medially. So we have this wrinkle on our medial side of the eyebrows here. Now let's talk about the eyelids. We have two eyelids, as we all know, the upper eyelid and the lower eyelid. Now, what are these lines present in the upper and lower eyelid? These are called palpebral sulcus. If it is present in the upper eyelid, it is called superior palpebral sulcus, and if it is present in the lower eyelid, it is called inferior palpebral sulcus. Now, in the older person, sometimes we also have two more sulcus. At the lateral side, we have malar sulcus, and on the medial side, we have nasojugal sulcus. Now, why do we have these so many sulcuses present in this area? The superior palpebral sulcus is present because there are levator aponeurotic fibers actually, aponeurotic fibers which adhere to the skin and they form superior palpebral sulcus. Malar and nasojugal sulcus are formed due to periosteum, and so is the inferior palpebral sulcus. The portion above the superior palpebral sulcus is called the orbital portion, and the portion below the superior palpebral sulcus is called the dorsal portion. Now, We have this elliptical opening between the upper and lower eyelid. This opening is called the palpebral fissure. If we are measuring the palpebral fissure from the superior to lower, from the upper to lower lid, this is called vertical palpebral fissure. And if we are measuring it from the lateral canthus to the medial canthus, this is called horizontal palpebral fissure. There are some cases like microblepharon in which this horizontal palpebral fissure is reduced, and there are conditions like ptosis. You must be familiar with the term. This the vertical palpebral fissure is reduced. The upper lid covers 2 mm of the limbus, and you can see in this diagram that the lower lid just touches the inferior limbus. The lateral canthus makes a sharp 60-degree angle, whereas the medial canthus is round. Now let's discuss in detail the medial canthus. Now, you can see in this diagram that we have this demarcation line which separates the white part of the sclera from this pinkish part. This whole structure right here is called lacus lacrimalis. Pardon me if I'm making any mistakes in the pronunciation. Now, there is this pinkish elevation right here. This is called caruncle lacrimalis, and this part, which basically is the demarcation line between the white part and the pink part, this is plica semilunaris. Now, if we draw the eyelid margin, we have this elevation right here, and there is a small oval structure present inside this elevation. This elevation is called papilla lacrimalis, and this structure, this oval structure is called punctum lacrimalis. Punctum lacrimalis and papilla lacrimalis, these two structures are also present in the upper eyelid. Now, the punctum lacrimalis will lead towards into the canaliculus lacrimalis, from which the tears will drain into the nasolacrimal sac. The margin of the eyelid, which is towards this medial canthus, is called the lacrimal portion. Remember, we're talking about the portion of the eyelid margin. And the portion of the eyelid margin which is away from, which is towards the lateral canthus, is called the ciliary portion. Now, if you draw this uh, eyelid margin in detail, now This is our eyelid margin. Now, this portion, the outermost portion, consists of eyelashes. We have 150 in the upper eyelid and 70, about 70 in the lower eyelid. Now, there is this gray line. It is actually called gray line, which separates the eyelid from the posterior part to the anterior part. This is the posterior portion, and this is the anterior portion. The anterior portion consists of skin and orbicularis oculi muscle, and the posterior portion consists of tarsal muscle and conjunctiva, palpebral conjunctiva actually. So here we have, you can say, meibomian orifices. Posterior to the gray line, we have meibomian orifices from which the meibum or oil layer of the tears is produced. So I have picked this picture from Google. This is actually a disease, blepharitis. You can see right here that we have this flakes of debris. This is actually blepharitis. So we will take the help of this diagram, this picture actually, and recall your knowledge. This is the outermost part of the eyelid margin. We have our lashes here. This is the orbicularis oculi muscle, and this line over here, this gray line, this is called the gray line, which separates the posterior and anterior portion. And these sinews, these openings, orifices actually, these are the meibomian orifices. Now, this appearance of orifices is not normal. Actually, these are clogged, which happens in blepharitis, and so they are quite prominent. I purposefully picked this picture out so I can make the orifices more clear to you guys. And this is a portion where the palpebral conjunctiva starts. This is a picture of lacus lacrimalis and punctum lacrimalis. This oval part over here is called punctum lacrimalis, and there is this small elevation. I don't know if it is clear to you guys. There is this small elevation. You can see this elevation. This is called, we all know, papilla lacrimalis. This is lacus lacrimalis, which makes the medial canthus. This line is called plica seminolaris, and you can see that there is a small ridge. You can see there is this small ridge over here. This is called caruncle lacrimalis. So this was the gross anatomy of the ocular appendages. I hope I have made everything clear. So, and once again, I would say sorry for my poor writing and pardon me if there were any pronunciation mistakes. So I hope you guys best of luck for your exams and for whatever purpose you are watching my videos. So if you like the video, hit subscribe and also hit the bell icon, like and subscribe, and goodbye.